World Health Organization pandemic agreement has reached advanced stages of being enacted, although African countries and developed countries have disagreed over pathogen access and benefits sharing annex.
The WHO pandemic agreement, adopted in May 2025, was designed to strengthen global pandemic prevention, preparedness, and response. However, the agreement cannot advance until the pathogen access and benefits sharing annex is finalized. The annex establishes the rules governing how pathogen samples and genetic data are shared globally to develop pandemic-related health products and how the benefits of these and from these innovations are equitably returned to all countries.
This is to ensure fairness. It's also to ensure that we strengthen trust among countries that are affected, because when a pandemic happens, we are all affected. All countries are affected, whether in the West or in the African countries. So we are strengthening that trust by this sharing, and also to support global solidarity in pandemic preparedness.
African countries want the pandemic agreement to address inequalities in healthcare.
We can't re-emphasize that. There is no clear guarantee that the sharing of pathogens and genetic sequence data will subject us to guaranteed, predictable benefit sharing, and these have been clearly stipulated. We are not assured that we'll get vaccines. We are not assured that we'll get diagnostics. We are not assured that we'll get treatments. And this is very pertinent. We learned from the COVID-19 days where there was vaccine nationalism. The world countries were taking and stocking vaccines, and as the low-middle income countries were struggling to get as much.
Like I said, if we are not, the PABS framework is not in place, it means we are invisible. The equity bit is invisible, and therefore our support in this engagement will be limited. And our support is not only about building capacities, but financing the complete and whole community engagement arena and agenda to ensure that we have these vaccines upcoming, they are accepted.
African countries are looking forward to a document that speaks to equity in promoting access to vaccines and the fundamental right to health.